Season 1, Episode 1. Hi, I am Dr. Kim Baker.
And I'm Dr. Robert Hammerberg.
Welcome to the very first episode of the Beyond Boundaries podcast, hosted by the Action Lab at UT Health Houston School of Public Health.
A podcast where we go beyond the classroom to share stories on how public health impacts our everyday lives.
Since this is our first episode, we want to first share with you why this podcast and why you should listen. So why this podcast? It's simple. Podcasts are a fun and simple way to share and connect. We have at our school over 1,600 students, over 180 faculty members, hundreds of staff, thousands of alumni, and our friends. And so what better way to open our doors and connect? Now, why should you listen? We truly feel that listening to Beyond Boundaries, you will hear from voices that often go unheard. Many of them students, alumni working across communities. A lot of times we call them our silent champions, and everyday people all working in real time to eradicate obstacles to health, specifically in Texas. So in this first episode, we will focus on a daily theme from the 2023 National Public Health Week initiative. We'll actually do that in each episode in this first season. This episode will focus on community.
So this episode, we'll have three individuals speaking with us on the topic of community. Mr. Ed Pettit is our focus for our Alumni in Action section. He is the founder and executive director of Wellspring Houston, co-founder of InnoGrid, and a doctoral student at Texas Southern University and a graduate assistant with the Bullard Center for Environmental and Climate Justice. He's also an alumnus of UT Health School of Public Health.
And so we'll go ahead and get started with our first question. Ed, tell me, what got you involved in public health? And specifically, did you choose public health or did public health choose you?
I would say it was both, but I can trace back my interest in public health actually all the way to high school. In my honors biology class, I had an assignment to review a recent news article through a biological and health lens. And I chose the cover story of a Time magazine article, I think it was like 1999, about the AIDS pandemic in sub-Saharan Africa. Mm-hmm. And I was just so moved emotionally by the story that I decided, hey, I want to do the kind of research that impacts, a situation as severe as this and as important as this. That's really a generational challenge. And so I decided to major in biology. I am from upstate New York. I grew up in a very rural area, and a lot of people don't know, but Cornell University is the land-grant university for New York, just like Texas A&M is the land-grant university for Texas. So I applied to the College of Agriculture as a biology major and realized I really wasn't interested in the plant biology. I was interested in the human biology. And I was on the pre-med track, but I hated being in labs. I hated being in the basement, mixing chemicals. I didn't like to be in hospitals either, I realized. I did some internships. I didn't like the chemical smell of the place. I didn't like, kind of being confined to that interior space. I wanted to be out in the field. So when I was ready to graduate, I said, I don't think I'm ready to go into this medical track, but I heard folks talking about public health. And so I wasn't quite ready to jump into a master's degree yet either. So I said, let's apply for the Peace Corps. I always loved to travel, and I really wanted to see, am I ready to face the challenges up front, the ones I read about in high school, And so I applied for the Peace Corps, and they sent me to Botswana, which at that time was the epicenter of the HIV pandemic. Botswana and Swaziland had some of the highest prevalence rates of HIV. And I spent 2 years with the Peace Corps and eventually ended up working for Baylor College of Medicine and Texas Children's Hospital on their pediatric HIV initiative. So, and when it comes to Peace Corps, they literally choose for you where
Mhm.
you're going and what you're doing. And so you can say that, yeah, at multiple points, this path was chosen for me as well.
Awesome, awesome, awesome. Great story. And connection to the work and how that theme is so consistent. I think in public health, we find ourselves public health choosing us because we're like, what exactly is this? I think this is for me when we're introduced to it. So good to hear. Okay, our next question. Thinking about your current work, share one thing that excites you about the work that you're doing.
So after completing my Peace Corps service and working with Baylor in Botswana, I was recruited to come to Houston to do my master's degree in public health. And I ended up working with the UT Health Prevention Research Center and attending UT School of Public Health, of course, and also was able to continue some of my work in global health with Baylor and Texas Children's. But I realized, when I was studying biology, I said, okay, I understand how the virus works, at the cellular level, but how does it work, when it comes to the individual level and all the sociological issues that the individual faces, and then again at the population level. And I thought, okay, I'll find the answers through public health. And then when I was learning, how to apply epidemiological methods and biostatistical methods to public health challenges, I realized, well, hey, even now we're addressing some of these things downstream after, the population is experiencing the impacts of what might be their environment, whether it's
Mm-hmm.
their physical environment or their natural environment around them,
Mm-hmm.
as well as some of the disparities based on where people live. I saw that so much of our health issues, our public health issues, were tied literally to someone's zip code or their census tract.
Mm-hmm.
And you could have differences between one side of the highway than the other, or literally being on the wrong side of the tracks, right? And so I was like, I'm not really getting the answers I want all the way through public health either. I still want to go further upstream.
Mm-hmm.
And so I started working on some projects in the neighborhood where I was living in Houston, which was and is Third Ward. And I realized that so much of the health issues in Third Ward, whether it's asthma, childhood obesity, mental health issues, drug issues, were tied to the environment of Third Ward and its history of redlining and disinvestment and disparate investments in walkability and green space and parks, and is prevalence of air pollution from the rail and the highways. And one of the groups that was working on this was Precinct One through their Park
Mm-hmm.
Smart program. And they were collaborating with professors at Texas Southern University's Urban Planning and Environmental Policy Department to create a decision support tool, which literally was putting together data and maps and overlaying them so that you
Mm-hmm.
could see how lack of access to green space and air quality and health outcomes were all intertwined.
Mm-hmm.
And through that experience of working on that kind of collaborative project, I was like, this is really where I meant to be, at kind of the intersection of biology and public health and urban planning,
Mm-hmm.
looking at these, what I call, or what's termed these sticky problems, right? In an interdisciplinary way, or these wicked problems, right?
Mm-hmm.
So I decided when the pandemic hit, I suddenly had some more free time. I want to go and do a PhD in urban planning. And one thing I should say to students is don't worry about having gaps in your academic career, because I had a big gap between my undergrad and my master's degree when I was living and working in sub-Saharan Africa. And I had another big gap between my master's degree and my PhD. And I feel like those gaps were helpful for me because I was able to apply what I had previously learned in the
Mm-hmm.
real world, tackling real problems, and that helped me realize what the gaps were. Because I realized, living and working and volunteering in Third Ward, that the gaps in my knowledge, really weren't going to be addressed by taking more public health classes. I was lacking the knowledge in urban planning and policy and environmental issues. And so I'm thankful for that gap, because otherwise I would have taken another 4 years of public health classes and still had the same questions about why the history and of the urban planning was affecting the health in Third Ward this way. Now, that being said, I am excited to see that the School of Public Health is looking more at urban planning and just environmental and climate justice and the history of redlining, incorporating that into the curriculum. I think there really should be more overlap between these disciplines.
Absolutely. And I think what you alluded to in your gaps per se between undergrad and masters and PhD was that action that you apply. Like we got to
Right,
be able to go out, do the work, learn from the work, right? And do it over again. The
right,
iterative process, right? And so thanks for sharing that. So so the work you're doing now, could
right.
you share with us like
Yes.
what impact are you working towards?
So when I started my degree, one of the reasons I chose Texas Southern University was
Mm-hmm.
because I knew that the professors there were really embedded in the community, and they really understood the challenges of disinvested communities, of Black and Brown people of color communities that had been redlined and experienced these kind of disparate investments and lack of investment. And one of those professors, Dr. Robert Bullard, literally is the father of the field of environmental justice. He's been doing this kind of research since the 1970s when he was mapping the landfills in Houston and how they were disparately placed in Black and Brown communities and the health impacts and sociological impacts of that disparity. And so I was very excited to enroll at TSU. I spoke to Dr. Bullard, and he ended up hiring me to be a graduate research assistant with a brand new center that was just founded called the Bullard Center for Environmental and Climate Justice. And so we're doing a lot of research that builds upon those decades of work that Dr. Bullard and his team have been doing. And recently I've been able to participate in compiling evidence for a report on the impacts of liquid natural gas development along the Gulf Coast. And I've also been working to assist with the redevelopment of CUNY Homes, which is Houston's oldest and largest public housing complex, literally across the street from Texas Southern University, and looking at how the design of that campus can better address some of the health and economic and social determinants of health of that community, which includes energy equity. You can't, have affordable housing if folks have a large percentage of their income going towards their electric bill. And at CUNY Homes in particular, the buildings are actually hand-me-down buildings. They were built for World War I soldier housing, and they just then became a public housing complex, and they were not built for central AC and heating. Residents literally have to buy their own window units and lug them upstairs to use them. And the campus is not meeting the energy and climate issues of this era. And so we're working with CUNY Homes as part of a grant they've received from HUD, the Housing and Urban Development Department, through the Houston Housing Authority, called Third Ward CUNY Homes Choice Neighborhoods. It's a national initiative, the Choice Neighborhoods Initiative, which is also a Justice 40 project. So in the current Biden administration, there's an executive order saying that at least 40% of federal investments need to go to disadvantaged communities like Third Ward. And so that's one of the current programs that's in operation that I'm assisting with, and actually I have a meeting with them later today to kind of look at the outcome of their plan that needs to be submitted by the end of this month. And if that plan is approved, then they'll get the $50+ million implementation funds to renovate and rebuild the campus. And so, that's a great project because I'm literally seeing all of this research and all this academic work I've done have a real impact on the community. And we've even done some kind of smaller demonstration projects. For example, looking at the Columbia Tap Trail, which goes by CUNY Homes, which really was built in a way that divided the residents of CUNY Homes and the rest of Third Ward from the trail itself. When they put in the trail, they dead-ended residential streets. They put in a drainage ditch, so it's literally surrounded by a moat that keeps the residents off the trail while serving what I call these weekend warriors in their Lycra spandex, riding their $2,000 bikes between downtown and the medical center. And so I said, this isn't right. The residents at CUNY Homes actually had to cross the trail and those drainage ditches to get to the washateria on the other side. And I would see residents, elderly women, walking with their laundry across a makeshift bridge they built out of cinder blocks and discarded 2x4s. And I said, this isn't right. So we worked with the Houston Housing Authority to use some of the planning funding to actually create a small pocket park. And the first phase of it is done. They'll soon be adding culverts and pedestrian bridges and lighting and benches to really tie back the community, that had been divided by that rail, which, had its birth in slavery, actually. That rail was built by enslaved field workers from the Brazoria County plantations so that the plantation owners could ship their sugar and cotton to Houston and eventually the port. And so, we're trying to, flip the script on this community disamenity and really make it a linear park that serves the community. And so those are a couple of the projects right now I'm working on that I'm really excited about.
In our Faculty in Action section, you'll hear from Gabriela Gallegos, Associate Professor, Attorney, and owner and Certified Race Director of Race El Paso.
My name is Gabriela Gallegos. I'm an Associate Professor at the El Paso campus of UT Health Houston, and a member of the Center for Community Health Impact. Most of my work focuses on food access and encouraging physical activity in adults and specifically women of color.
Awesome. Our first question is how you started in the field of public health. And we like to say, did you choose public health or did public health choose you? So tell us a little bit about that.
So I definitely think public health chose me. So I got started, my career is a little bit offbeat than, most others that you see in academia. So I started out as an attorney. I chose to move back to my hometown of El Paso after living and going to school in New York, California, and Dallas. And when I returned, I saw a completely different version of the city that I grew up in. So I saw dialysis centers on a lot of corners and had a lot of questions about, well, what is that thing? I don't understand what that brand is. I noticed right away that there was far less infrastructure than I was used to. I was used to there being, trails and, different opportunities for kind of natural, going for a walk somewhere and having a place to go. I had also started participating in triathlon a couple of years earlier. And that was one of my big questions is, how do I find people who do the sorts of things that I now really enjoy doing? And it had really been a game changer in my life. I had kind of been, someone who went to the gym casually, but that gave me a little bit more motivation because there was a goal that I would set and work toward. And so it was just really important to me and kind of really shaped how I was doing things. And so a couple of years after moving back, I, was really frustrated and there was a need for production of triathlon here. So I jumped in and kind of assembled the best team I could find, right? I had, a committee of others who also didn't know what they were doing. But I had, a CPA doing registration, I had the highest ranking Marine stationed in El Paso as my safety director. I really tried to find as many people who would help me figure out how to do this. I got certified as a race director and produced El Paso's first USA Triathlon certified event in 2010. And quickly learned that I had 80% of about 450 participants who had never done this before. And that terrified me. And so that turned into, a shift from this is offering an event to this is education about how to engage in a new physical activity venture. And so it really turned into a public health intervention, more than anything else, where there were educational clinics. It was intended to create community. And so somebody could come to an educational clinic by themselves and walk out with invitations, to go for a run, to go for a ride, that sort of thing. So that continued and grew, and that business is still going. And now there's 6 annual events. But a few years ago, I wanted to go back into kind of my public policy roots. And so I started trying to understand where that skill set could be used and where I could start applying that more systemically. And that is kind of where I found public health. So I started doing some consulting work on the Healthy Food Financing Initiative with El Paso County. And that is now something that I continue to work with the county on. But it really married the public policy legal background, right? And understanding how political systems work and how systemic change is really started with policy, and the economic piece, because I am a small business owner, and so I understand the challenges of, the bottom line and hiring employees and how you might make changes and how all of that is kind of connected. And so that's really where I found public health and continue to do a lot of community-based work that is both economic development and systems change.
That's great. And you've touched upon some of these points, but I'd love to hear you delve a little bit deeper into the health issues that you see within your community and the work that you are doing to address those, either through your faculty position here or through or the Center for Community Health Impact.
Absolutely. So El Paso is predominantly Latino, I think over 80%. I think it's close to 85%. And we are a bicultural and binational community, right? So it is where 3 states intersect, Texas, New Mexico, and Chihuahua are all, at that epicenter. So if you think of the entire community, it's quite large. It's a few million people. But again, there are very unique issues because of the border. It also means that we have kind of grown up understanding 2 cultures and really being able and just being shaped by it. It also means that our health challenges are fairly unique, right? We see a lot of diabetes. We are a low income community by and large, and so we see kind of all of the effects of not having adequate access to healthy and affordable food. The affordability is a driving factor in a lot of the community challenges that we see. And so, diet is potentially one issue. The lack of infrastructure for things like physical activity is another issue. But we see a lot of prevalence of diabetes, hypertension, obesity, and all of that kind of ties to the food access and physical activity work that we do at the Center for Community Health Impact. So really it's community informed. And so those issues that we address and kind of prioritize are those that are really community driven. So an issue is raised and a question is, how do we start looking at this and how do we address it? And that is where we've been trying to respond to those community inquiries that come in. And some of it is just kind of by happenstance, right? You're working with somebody on a particular project and new things come up. And so then you kind of find an offshoot of what your initial work might have been.
Yeah, and I think a great follow-up to that, because you touched on you're impacting public health in several different areas and through many different means that I think is very exciting. But if I were to ask you, of all the work that you're doing and all of the things that you are seeing within your community, what is one thing that excites you?
Oh gosh, there are so many. So I'm going to say 2. So kind of what we've been working on with food systems is really exciting. El Paso is very isolated. And so although we are in Texas, El Paso is closer to LA than it is to Houston. And Albuquerque is 4 hours away. Tucson is 4 hours away. But the reference points that we have for things like, getting food truly from point A to point B and those channels are not easy, and it's had a real impact. The questions about the border and what kind of foods can come from Mexico, all of that also impacts, right? Because there may have been a channel that can go from south to north instead of from, east to west. And so trying to figure out what is needed is a big challenge and really exciting. And working with different community organizations and municipalities like the county, the city, some of the smaller municipalities in rural areas, each of which are doing different kinds of work. And the exciting part to me is kind of taking a step back and getting a bird's eye view of where there may be gaps and also where there's really exciting things happening that just need to be connected to the rest of that food system. So that's one. The other one that I'm truly excited about is that I'm starting to do research in the area that I have been working in for the past decade, which is trying to get people more active and more physically active. And my focus has really been adults, right? I think it is, there's a lot of focus on kids being physically active, which is really important all by itself. But what happens to the adults? The physically active kids may not be physically active 40-year-olds, right? And so trying to understand what is needed to create all of the conditions that will get people more physically active, right? Whether that's infrastructure, whether that's goal setting, education, community, and really trying to pinpoint what kind of formula would really contribute to that, just because of all of the benefits that we see from, from managing obesity and diabetes to mental health benefits. There's just so much that changes if the community culture as a whole is able to shift into being a more active community.
Yeah, so couple questions. And just to kind of like follow up on everything you share, because you mentioned this shift, which is very, very, very important, right? And so in your, like from where you stand and your vantage point, whether it be regionally, because you talked a lot about El Paso and the region and how unique it is. Very true. What do you think needs to shift more to go beyond how we traditionally approach public health? Thinking about El Paso and the region and your partners, like where do you think we need to do more of?
So I think we need to think more like a community instead of as an individual. And I really think that that's critical in cultural shift and in public health generally. I think that's true nationwide and worldwide, frankly. It is a very difficult argument to make if you are only talking about the individual. It's kind of like voting, right? Somebody might say, well, why do I vote? I'm just one person. It's not going to count. But if you think as a community and as a collective, and that is very powerful, right? And that can be a force. And you kind of see these networks spread, right? You see one person who potentially gets physically active or is trying to change the way they eat, and then the family notices, and then they experience small shifts, and then the kids want to do that. And so you see that happen because people start thinking like a community rather than thinking only about their own interest in it. Somebody's interest may be very powerful and very important, but considering how to think as a community, I think is really critical to moving things forward.
Awesome. Thank you. And so share with us a little bit how students can be involved in the work that you're doing.
So there's always opportunities for students to jump in. Some of them are more structured, right? And that might be like a research assistant or, a more formal position. But there's also times that projects come up and we just need help, right? And so doing things like data collection could be really fun and give students that ground level understanding of the project that might be analyzed, and if they read about it they may not get kind of what it looked like on the ground to just do a bunch of site visits or talk to a bunch of people. And so I do think that there's always opportunities for that. There's also opportunities for those who are not in whatever area that they want to be in, to do things virtually and through distance, right? There may be specific projects that are we're missing this piece of the research and we need to understand more about what one part of it looks like. And that may be where a student can jump in as well, even if they're not able to be on the ground.
Awesome.
And thinking about our robust alumni community too, what opportunities do you see for alums to either get involved in the practical application of your research or just through your organization as well?
So a couple of things. The first one and the most obvious is practicums. There are always opportunities for students to jump in and do work that could be really meaningful, both for the organization and for the student. And sometimes those are connected with the work that we're doing in the community, right? If a student is interested in something like food access, there are so many community partners that are doing exciting work, all of whom are short staffed, right? And all of whom need additional, brain power on the work that they do. And so I think that's a really good opportunity. Alums could also potentially connect just by sitting in on, there's so many lectures and workshops and things that are offered by the School of Public Health, and that might give them a pulse on the research that is happening and where they might be able to connect, either with the organizations that they, are in and potentially leading or just a part of, or because they're getting ideas of where they want to go next. And so I think that that's another opportunity to just keep a pulse on what might be happening with UT Houston School of Public Health.
Awesome. I think we went,
I think that covers it.
Yeah, it eventually did. This was great.
In our Community in Action section, you'll hear from Dr. Aisha Siddiqui, founder and CEO of CHAT, which CHAT stands for Culture of Health Advancing Together, and she's also an alumnus of UT Health Houston School of Public Health.
Thanks for the opportunity. So the name of the organization is CHAT, which stands for Culture of Health Advancing Together. It's a nonprofit organization that I created in 2015 with a mission to improve the health and well-being of immigrants and refugees through education, arts, advocacy, and access to care.
Amazing. And so you just told us a lot, right? You just told us in less than 10 years ago, you founded this organization, right? Which is amazing. And it fills a huge gap in Houston. And so for those that you all are listening, you may know that Houston is one of the diverse cities in the nation, if not the diverse, right? And so the needs of immigrant and refugee people are great and vast, right? And so we are very interested in why you saw fit to start this organization. So if you can share a little bit more about that.
Yeah, so I'm an immigrant myself, right? So that's the thing that when I was doing my doctoral dissertation, and Dr. Linder was my advisor, and I said, Dr. Linder, the burden of hypertension and heart disease and all those kind of diseases is high in South Asian women, so I want to do some work on that. So he said, Aisha, you already know it. You're telling me that, so you already know it, so you need to dig deeper and see why, what is there. And have you ever thought of acculturation or lack of it or how it's impacting? I said, that's very, very interesting. So that's when I started working with the South Asian women, and I decided to work in the area where most of the South Asian people, or I don't know, for some reason, everyone who comes into Houston starts their life, which is the Gulfton, Sharpstown area, Southwest Houston. So I started doing the key informant interviews and surveys, and then I remember I used to meet in one of the apartments in one of the residents' house, and then the women will gather there and we will talk about it, and we will do interviews, and so the lack of acculturation and the impact on their health. So obviously I collected my data, I collected all the information, my dissertation was done, and then at that point I told my husband, I'm not going anywhere. I'm staying here.
Yeah. Plenty of work.
Plenty of work. And I know that after your doctoral degree and your PhD or your DRPH, you're expected to work and just bring in the paycheck. And at that time, I was teaching part-time at University of Houston downtown in St. Thomas. But my husband said, no, you have my full support. You can do whatever you like. So initially, when I started the nonprofit, I was teaching and doing it part-time, but then soon enough, within a few months, I realized this is not happening. This nonprofit is more than a full-time job. It's 2 full-time jobs. So then I quit that and then started working with that population. So that's how the journey started.
Amazing.
Yeah, so, with your near 10 years of CHAT being a service to the refugee population here in Houston, I'm curious, over the last decade, what you've seen in that community. There's been a lot of changes within Houston within the last 10 years, within our nation too, politically. Different administrations coming in and out, a pandemic. So I'm curious what your observations have been over the last decade with serving the refugee populations that you do here at Houston.
So first of all, the thing that changes is the refugees themselves. Like sometimes it's people from Bosnia or people from South America, or people from Middle East. Right now it's mostly people from Afghanistan. So then the whole dynamic of our work changes. At one point we have to have people who speak Spanish, and then immediately people who speak Arabic, and then now people who speak Pashto and Dari. Because if you are working with any underserved population, if you're working with any pockets of people, you have to first gain their trust. And without language, you cannot gain their trust. So that's the most important thing that chat has. Like we get people from the same community and then they speak the same language so that we can serve them. So that's one thing, the language access. Because whenever the population changes, the needs change. And then in the past, all that time, for the Gulfton area especially, we have seen that a lot of work is being done. In the beginning, when I started this work, it seemed like there is no one, and no one knows. I remember at one time I was speaking to a group of students at University of Houston, and I was telling them about the work, and one student, he stood up and he said, I hope you are not spending our tax dollar on refugees. So that was the sentiment. And from now on, like a lot of work being done. So that's good that many agencies are working. But again, at the same time, people are struggling, people are suffering. And then we, in the United States, we still do not have all those facilities or all those programs that some other countries have for the refugees. For example, when they come here, they work with a resettlement agency, and then they just put them, for example, give them an apartment and like some blankets and some food in their refrigerator when they arrive. And then the caseload is so high on caseworkers that sometimes they don't come back for weeks. And then these people are stuck there because they cannot speak to anyone, they cannot go anywhere, it's a new country, and it's very different. Like I tell you a few stories that can tell you, people get lost easily. So this lady called me and she said, I'm lost. And I said, how are you lost? She said, my husband dropped me at the school, and then I came out, and then husband left. When I came out, I didn't know, and then I started walking, but my home is not in that direction. And so now she cannot read the street signs. She cannot ask anyone. She doesn't know where to go. Sometimes they walk for miles and miles, for hours and hours, just to go to a clinic, whereas there a same kind of facility is very close to them, but they cannot ask. Same thing with the student. They are being bullied so much. They are harassed. They're miserable. Like a lot of times schools just call us, could you please come, because this so and so is crying and we don't know how to communicate them. We don't know how to ask them what is bothering them. So all those things are still there. All those problems are still there. So yes, there are a ton of refugees. Yes, there are a ton of agencies working in there. But again, the struggle is out there. And people are in a very tough position. If you can't speak English in Houston, it's hard to find a job. And then a lot of times their paperwork doesn't get done. They don't get the food stamps that they should get. They don't get the Medicaid that they're supposed to. So all those struggles. Yeah.
Thank you for sharing that.
Yeah, no, I'm curious too. You've spoken a lot about different needs within that community. I'm curious too, but your personal thoughts and takeaways of how you were able to apply what you learned here to the work that you're doing.
Oh, this is all what I got from here.
Really?
Yeah, exactly. That's my background. If I go a little bit back, my background was biochemistry back from Pakistan. I did my degree in biochemistry when I came here, but my heart was always in public health. At that time, I didn't know the word public health, at least the degree in public health. So it was always maternal child health, and I wanted to do something and learn and then go back home and serve. That was Aisha back then in 1985. So one of my friends at that time, I don't know if you may know or remember that at that time the public health degree, especially the Masters of Public Health, was mostly for people with medical background, like MD, so MD and PhD. So then one of my friends, she was a physician from Pakistan, she was applying. She said, I'm applying for this Masters in Public Health. Do you want to look, like I was interested, and she said, yeah, do you want to look into it? I said, yeah, and then we both applied. Guess what? She could get in, I did. And that's where my journey started into public health. And then I did my MPH and started working for the Houston Health Department. But I was still not working in the community that I wanted to do. So that's when I came back, did my degree, management policy and community health practice, and then you know the rest of the story. Did I answer your question? I forgot. It's just like
No, yeah.
Yeah.
Absolutely.
Practical application of what you
Yeah.
learned here to
Yeah.
the work that you're doing.
right. And then the other thing is that I'm not doing it alone. I'm still very much in contact with the faculty and the school. So one of the faculty members is on our board. One of the faculty members is our advisor, and we do a lot of work together. So yes, it's completely all the application.
That's right. Integrated throughout.
Yeah, throughout.
That's so awesome. So you've shared with us kind of why you started Chad and kind of what you're seeing and why this is so important. Very complex things. You can get it. Yeah.
Okay.
There you go. You can bring it over here if you
sorry.
like too. Oh no, you are fine.
Is that where she's
Yes. So my next question is just thinking about like the work that you're currently doing, like what excites you the most about it?
Oh, that's a good question.
One thing, right?
Yeah, the community, of course,
Mhm.
the people.
Mm-hmm.
You know, when we see the difference that we are making, because like one of the examples is that there was this student. This child came from South America, and the parents were here. So he joined later. He was living with the grandma. He was 9 years old, and very unhappy because he could speak English. So I kept telling his mom, I knew the mom. I kept telling him, you need to send Hector to Chad. You need to send Hector to Chad. She said, Hector just doesn't get, it's hard to engage. But anyways, Hector started coming there. And then we started seeing the change. Hector is happy, he has friends, and he told his mom that I have friends. She said, where are the friends? He said, at Chat. And then they were just, and the funny thing is that some of them would speak Arabic, some Spanish, some English, so it was not the common language, but being with peers, being with friends. So then in like a year later or so, we had a summer program and we had a theater, like summer camp. So after the summer camp, we had a production. The kids wrote the play, they produced it, everything, and then the play was, parents were there and teachers were there and everyone. And then at the end of that, the mom had tears in her eyes. She said, I can't believe that Hector, who could not speak a word of English, is now on stage delivering dialogues, and he's so confident. He's not the same Hector who would run into his room when we had company. So I think that's the difference. That's what it is. Like kids would come and they don't want to leave Chat Academy, or women now that we were in an apartment, but now we are not in the apartment, in a different place. So all the people who used to come to the sewing circle in the apartment, they're very, very unhappy that they cannot go there. So yeah, the community. But I couldn't do it without the students from this school, from the students from University of Houston, and then other institutions of higher education and high school, because when I started Chat, there was zero money.
Yeah.
There was no money. Someone made the website, she said, no, I want to give back to the community, and she just made it. And then said, Aisha, now you need to open up a bank account. I said, I'm going opened a bank account. She said, where is the money going to go? I said, what money? Because I only created chat thinking that I cannot work as an individual, so I have to have an organization. She said, you will see. And then I opened up the bank account, and then, it's just gradually, it was enough to pay for some candy or some food for kids or something. The rest, everyone was a volunteer. Everyone was a volunteer, and we had a big pool. The students love to interact with the refugee kids and help them with the homework, help them. And then other agencies collaborated, like Houston Center for Photography, Photo Fest, the great little company, the theater company, and then Nameless Sound. A lot of organizations and museums, they all helped us in delivering the program or enrichment programs. So that's how it started. And now it's just...
That's amazing.
Yeah.
Yeah. And then that feeds into one of our last questions, which were, how can students today get involved in supporting you in chat?
Yes.
So there are several ways. I mean, you can post our website, which is posted, so they can look at the, I think, is it the handshake?
Yeah, handshake. Yeah, there you go, handshake.
So they can check there. And then many faculty members send their student for their class projects or practicum.
Nice.
So that's because one of the student they can work with the community, they can work like in the after school program or in school social emotional learning program or women's circle, but other students can do like be part of our strategic planning or be part of evaluation or be part of our like our impact report or annual report. One of the students from UT School of Public Health is currently doing her project with us. Like I think it's her practicum, and she's working on her annual report and the impact report. So there is a lot of choice. There is a lot that they can pick from, whatever their interest is, and we love to have those students.
That's great.
That's awesome. Thank you for listening to the Beyond Boundaries podcast, hosted by the Action Lab at UT Health Houston School of Public Health. Be sure to check out the links provided to learn more about the guests and the info shared in this episode. And remember to always go beyond.